Hi, welcome to another episode of Cancer Tamer. I'm your host, Dr. Charley Ferrer.
And hi, I'm Deborah Santulli-Barone.
And today our show is focused on all the different activities, not all of them because we only have so much, but different activities and different resources that are available for you as a cancer patient or a loved one to be able to get more information. Do you want to start us off?
Okay, so I like to get into fashion, and this was a great article in Cure magazine about coming into fashion, and it talks about how these organizations boost confidence and appearance of women and even men with cancers. So sometimes they go to the hospitals and they do facials, they put on makeup. Like there's one organization, Look Good, Feel Good. And they go around, they do makeup lessons, skincare, and you can look at it online, lookgoodfeelgood.org. They're very good at that, and they're worldwide. They go all over the place. There's actually Sephora has a Brave Beauty, and it's called sephorastands.com, and they give makeup lessons to people, and that's nationwide too. Right. Then we have Cancer Survivor Beauty and Supportive Day. And that's nationwide. And how about Diva for a Day, which we both were divas.
Exactly.
Which we belong in that category.
and yes, and there's different organizations that do different things. And one of the important things to realize is that as you are in medication, as you go through chemo, as you go through radiation, as you have this medicine that you're on, if you decide that's the route of treatment that you want to go, it will change your body structure. It'll change your chemical structure. So you may need a little help with the makeup. You may need a little help with, what you want to accentuate a little bit more. Even true. Walgreens is doing something now with their beauty consultant.
I think that's great.
Which is wonderful. It's Battle Beautiful, I think is what they call it. Yeah. And so they help you with the makeup and they help you with
skincare too. Yeah, because your skin gets really dry and you need to know what to use that isn't like a hormone disruptor, because some chemicals in your creams will disrupt your hormones.
Exactly, or some of them are, have an estrogen base, which if you have cancer, breast cancer with an estrogen base or ovarian cancer, those are very particular things that are going to, endocrine disruptors that they will mess with your body. So being able to then be sure that you look at those. And also, going holistic. So using essential oils instead of, or
pure essential
oils. Because there are some essential oils out there that are made
synthetics, right?
They're synthetic, or they have not that they are synthetic, but that they are made with synthetic so that they last longer. So they put a little bit, like 5% essential oil, pure, and the rest of it is junk.
Oh, okay.
So knowing where your essential oils are coming from is really important.
Right, that's true.
And we have we did a couple of shows before with a few women here that use different products, essential oil products, and those you can find on cancertamer.org to be able to look at those old videos.
Right. So besides that, then there's Mondays at Racine, that's in New York too. Beauty Bus Foundation that actually has in-home beauty visits. They come to your home, and then Lipstick Angels that works in different hospitals, giving hand cream massage or putting makeup on while you're in your infusion waiting for your chemo. Fabulousandfighting.org, that's another one that has free designer clothes, believe it or not. Who knew that? I mean, and
we're going to have to go look them up.
Yeah, and that's based in New York City. So, talk about the Big Apple. And then there's fashionfightscancer.org is fashion and design workshops so that you learn how to dress, because let's say your breasts are gone or you lost a lot of it, and now how do you dress?
I went from double D's to B minus.
I can attest
to
that.
It's that different feeling of also how do you see yourself and how do you comfort.
Right.
Because I had to go through a whole new wardrobe and give away like all my tops.
You went through so much shopping too.
Retail therapy is awesome.
Right. But or even losing weight. I had lost a lot of weight, and so maybe you get you get some tips on how can you still look a little curvy or shapelier, or you lost your butt. Okay, now what do you do?
Yeah.
Type
Or
of
how
thing.
to
But it's all fun. It's
how to
all
get those
fun.
colors in.
Yeah,
And if you've never done it before, it's awesome to be able to do it now.
Definitely. And
you
there's
know?
actually even tattoo
Or
artists
reinforce.
again too that can do eyebrows. If you want them tattooed, or you can do whatever. But because you have to feel good. If you're gonna sit home every day, and I know it has to be horrible going through certain treatments, but to wake up and try to give yourself a little look that you can feel good about yourself.
Good. Yeah. My thing I always used to say, and I still do, the better I look, the worse I feel.
Really?
Yeah,
Oh,
because whenever I felt really horrible and I was going through the treatment or I was having all the complications, I wouldn't leave my house until I looked perfect.
Right.
I had my makeup on, I had my hair done, I styled it, I did everything.
That's good.
Because I wanted to at least have one thing that looked good in my life.
And that is
that
normal
was it.
thing that you've always done,
Yeah.
So that's
And
good.
no, actually,
Really?
I wasn't.
Oh, you've changed?
I changed, and I became even more emphatic about having my makeup on and having my hair. Because sometimes I just didn't care. It's like, you didn't like the way I looked, that's your problem. I looked nice. Not that I look like crap, but I dressed nice, and I didn't always put on the whole face.
Oh, okay.
I would just put on lipstick and some mascara, and that was it.
Oh.
But after that, I was like full face, full cover.
Anything to make you feel good. Whatever makes you feel
exactly.
good. Yeah.
It
That's
made me
true.
feel good. It made me feel pretty.
Right.
And
Right,
so
that's true.
that was what was important for me. Or when you saw me, it's like, oh, well, and I had people go, well, you don't look sick. And I'm like, thank you very much. That's an awesome thing for you to say to
that's
me.
true.
It's a stupid thing to say.
Yes,
but
'cause
it's
you
an
know how you
awesome
feel.
thing to say.
Yeah.
It's like, good, I didn't want you to notice,
Right.
because when I'm at the house, that's when the pain starts, and I let the
Right.
pain seen, and I look like crap, and I feel like crap,
Right.
and I just sit and become a little potato,
Right.
on the side. And so it is that piece of feeling good about yourself. And when you feel good about yourself, then you're able to
function better too. I
function
think.
better and feel
Yeah.
better and get a better spirit and
Right.
and be more motivated and so on.
Right, that's true.
Yeah.
And also sometimes with the skin, again, I'd like to bring up with the dry skin because of certain estrogen blockers or other medications. Again, try to find something natural. A simple thing I've heard, was it coconut oil, unrefined? You can use
Right.
as even olive oil, to get your skin nice and smooth.
Right. And it's
Yeah.
not just your outer skin.
Right.
It's also vaginally.
Right.
Because,
That's true.
some of the medicine that you take will dry you up.
Yep.
And so being able to find a lubricant that is
natural,
that it's not going to affect you. So
Right.
talking to your doctor about what's good, what's not.
Right, that's true.
Deciding on whether you want a water lubricant or a silicone lubricant and the difference between those, And one thing I always have to tell people, be careful with silicone and any kind of
condoms.
greasy, kind of greasy lubricants if you're going to be in the shower.
Oh, yeah.
Because you don't want to slip and fall. So water lubricants are best when you're having fun in the shower.
Oh, okay. That's funny.
So it just keeps you
Things
safe.
I never thought of, girlfriend.
As a clinical sexologist,
Yes.
I bring up these little issues. It's
that.
really
That's so
important.
funny.
But find what makes you feel more comfortable. Find what
Right.
makes you, what works best for you.
Right,
And
that's
realizing
true.
that what may have worked good for you,
Doesn't
a year
anymore.
ago or, a few months ago may not feel good for you
Right,
now.
that's true.
And so talk to your doctor, talk to your gynecologist.
Mm-hmm.
These are issues that, yes, they might be embarrassing. And you might feel uncomfortable going, I'm kind of dry. But it does,
But you
it is
have to
that,
talk
it
about
is
it.
that discussion that you need to have.
Yeah.
And especially if you've had endometriosis or if you've had any kind of vaginal or ovarian
right,
or
stuff like
cervical cancer and issues, you need to talk to your oncologist, show that sex is not painful.
Right.
And if sex is painful, you definitely need to talk to your physician to say, hey, it hurts.
Right.
Whether you're dry or not, because if you've had cervical cancer, they do shorten your vaginal area,
okay.
you know, and your vaginal canal.
Right.
And so instead of you having enough, it might be smaller,
and that
and
can hurt.
so it'll hurt. So it's also not just that you have to give up sex altogether or have pain, but maybe certain positions you may have to get a little bit more creative, or even with women with breast cancer, you know, you need certain positions. You can't have your partner on top of you at the beginning because it hurts your breast.
Or laying on your belly, you know, that hurts too.
You know, it hurts.
Yeah.
And so finding different positions, you know, doing the cowgirl, doing, you know, you on top where you're able to control the penetration.
Right, I'm cowboy.
And you're able to control penetration, you're able to control, you know, the pressure on your body,
the depth
and the depth, you know, sometimes with your partner from behind.
Oh, like a spooning.
Yeah,
kind of a thing.
and so being able to do that position might also alleviate it a little bit more. Not that you're having anal sex, but you can, you know, and with anal sex, making sure lots of lubes, going very slow. But sometimes when you have vaginal issues, then your partner being behind you and doing penetration from behind will be a lot more comfortable as well, because again, you don't have the pressure and the penetration isn't as deep. Plus, the good part about that is that now you can play with the hands, you know, and do some stimulation.
Just don't grab too hard.
But you know, you can stay away from the breast, but you can play with the clitoris, you can play with other areas of the body, you can hold your partner. There's so much that you can do sexually to be able to be fulfilled sexually and be able to be happy.
Right.
And it's so important. I mean, and I always tell people, kinky people talk about their kinks and talk about what they want, and vanilla people, those that aren't kinky, don't talk. They expect their partner to know what feels good, what feels great, what they like. And it's like, they failed Psychic 101. But so make sure that you talk to the person about what feels better. This feels better, this doesn't. And the only way to know that is what? Trial and error.
That's true.
You know, it's just keep trying. This didn't work. Okay, let's try it again later. Because it might be that today it didn't feel comfortable, but next month it does.
Yeah, it might do good. But I really believe, I don't know how it is with men, but with women, it's a lot of psychological too, because if you feel that your partner, whoever your partner is, can understand what you're going through, I think that's half the battle of feeling this great feeling that you have for this person, that you want to be with them, that you want to do things to please them too. That really helps.
And that's an intimacy issue. That's not so much a sexual issue. It's more of an intimacy issue. And understanding when, you know, and I always tell people, men and women address sex in different ways.
Totally different,
And, you know, women need the verbal, mental aspect before they get physical. Men need the physical aspect before they get mental. And
that's a good way of putting it.
You're getting them both, but where
at different times,
where we falter with each other is that we're going, no, give me the mental and then I'll give you the physical. And the other person is going, give me the physical and then I'll give you the mental. And so it's like, let's do both. Today we'll do physical, tomorrow we'll do mental. Today we'll do this, tomorrow we'll do that.
So you compromise.
That's a good compromise, which is really important to do with each other. And understanding that sometimes you just want the sex. Male or female. You just want the sex. And you can say that to your partner. Hey, I just want you to plow the fields and we're over with it, and you know, and then I just want to get up and get away from you. I just need this thing to show me that I'm alive, that I'm good, that I'm still lovable or huggable or still a woman, still
attractive,
a man,
you know,
whatever it is, because men feel the same way. And so being able to be that honest with your partner takes a lot of guts. You know, and it does take a little bit of intimacy. So then it just becomes the part of, let's talk a little bit more.
Yeah,
and
because it has to do
when
with
you and when you have this disease, it's more of, it's a wonderful opening to talk. And if you never did it before, then do it now. And you don't have to be comfortable talking about it. because you're going to be uncomfortable right at the beginning. But the more you do it, the more comfort that you find. And the more you can talk with your partner and you can start learning things about your partner. And what I think is this is an awesome opportunity to be able to build that intimacy with your partner, even if you didn't have it before.
True.
Here's a wonderful opportunity for you to start that relationship all over again, and start it from a different perspective. And I would even say a more honest perspective.
True.
You know, and honest from the perspective of
you're telling me what you feel,
telling
right?
me what you feel instead of thinking what you think you know. You know, because you don't, unless you actually say
closer.
It. So,
I've heard that, you know, it could bring you closer having the cancer, and then other, you know,
it can
spread you apart, because, you know, you might be in pain and your partner doesn't
partner doesn't
or
know
doesn't
it.
even believe it. You know, they're thinking, oh yeah, it's just, instead of saying headache, now it's pain. You know, you don't know.
Yeah.
You know, but that's their problem and that's
their issue.
Yeah,
but it's also up to you to say this is not comfortable for me, or we need to find different positions, or we need to, you know, look at different possibilities. There's a great book out there that is called Sex Unlimited. I actually wrote it.
I knew she was going to say that.
I actually wrote it a few years ago, and it's called Sex Unlimited. And it actually provides you with different ideas on different positions. You know, even from the fact of not just being having cancer or anything else, but also from being heavy or skinny or you know, being able to be bendable, you know, and it gives you great ideas on different things that you can do. And sometimes being sexual is more of a mental aspect as opposed to a physical aspect. Because if you capture the brain, you capture everything else. You know, and women are just as visual as men. It's just that we don't express it as much, or we look at it from a different perspective. One person, and I can't remember her name right now, but she did a whole study on visual and women and sexuality and being very visual. And so what she discovered was that women will see something just like men will, and the only difference is that men will say, oh, okay, that's sexual right there. Women will make a whole story around it.
True.
You know, it's like, well, you know, if the hands are sexy, then it's not just the hands being sexy, but what are the hands doing?
Right, and what are they touching?
So, yes, and so the woman will fill in all those aspects of it, where the man will just say, oh, that looks good. Those hands are great. I want them here. But the woman is doing this whole story behind it. And she did this wonderful exhibit, and I'll remember her name later, and I'll put it on the website. But it is one of those wonderful little aspects of understanding that we all look at sex in a different way. Whether it's women and other women, or women and men, or men and men, everybody has their own aspect of how they look at sex. And sex is not just sex. Sex is all the different things that we incorporate with it. Our cultural beliefs, our physical beliefs, our mental beliefs, our what our friends say, what we learned, what society said, what we saw on TV, what, you know, it's like boom, boom, boom. And so it's not just sex, it's everything else that we don't even realize is incorporated with that. Because there's so many sexual issues in American society, but nobody talks about sex. You know, and there's
supposed to be taboo.
You know, yes,
and cultures do that too,
but
right?
everything is sold with sex.
Yeah, it's
you
true.
know?
Anything on TV you see.
Anything on TV,
totally,
you know. And I'll mute the television and I'll just look at the commercials and I go, wow, they were really like doing sexual stuff here, and it's like, you know, toilet paper, you know, or
so good.
You know, sneakers or something. And I was like, oh, I would have never thought that if I had the, you know,
the sound on.
If I had the sound
That's
on.
True.
So talking to your partner about sex, talking to yourself about sex, if you weren't in a relationship before you got breast cancer or any other kind of cancer, then realizing for yourself, how are you going to, you know, get into a relationship now? Because it's
moving
not
forward.
And I think, you know, I think the other piece too is that after, especially for women with breast cancer, that's not something you could hide. You know, you're going to see it in your
Right,
clothing.
whether it's scars or,
But
you know,
yes, when you
no
take your
breast,
clothes
yeah.
off, you're going to see those scars.
Yeah.
You're going to see the deformity. You're going to see, one breast is bigger than the other. You can hide it with a bra, but you can't hide it when you're open chested.
Right.
Which, here's my big bitch session on this, because the surgeons should do a hell of a better job of stitching you up than they do now.
Right.
Because they figure, oh, well, we'll do it underneath and you can't tell.
Yeah, I mean,
well,
like
of course you can
Frankenstein,
tell. Yeah, because
stitching.
so the stitching is horrible. Plus, when they do it underneath the breast, my understanding is they do it underneath the breast because you can't see as much scarring.
Right.
But now you have another issue, which is your damn bra is there.
Oh,
and
yeah,
so now
it
it's
has to hurt. Yeah.
pushing against those stitches. Even years later, it'll still hurt.
Right.
So being able to notice how you feel and how that's going to look. And so before you have breast surgery, making sure you talk to your doctor about, what's my level of scarring?
Right.
Are you going to be able to do it correctly? Are you going to, are you going to leave a little bit bigger breasts here on the cancer breast as opposed to the non-cancer breast, so that when I go through radiation and my breast shrinks,
right?
Will that take into consideration? So, I mean, these are all issues.
Yeah, I don't know if they think like
you have
that.
to you have to talk about.
That's true.
And they don't talk about it, and they don't tell you. So, the book Breast Cancer from Diagnosis to Surgery talks a lot about the issues that they don't talk to you about.
Yeah, because no one told me, if one was going to shrink. I had, brachytherapy, which is internal radiation. And no one said that there'd be a hard ball here, from the radiation. It's hard over there, because every time I, check my breast, I get scared. Oh my God, is that a tumor? And then they told me later on, oh no, you get that with the radiation. I'm like, why didn't you tell me ahead of time?
Why did you tell
The first time I felt it, I thought I was going to have a heart attack. I'm like, oh, damn.
And so it does become the part of making sure you talk to your doctor about all these things.
Right.
And so, being able to say, what am I in for? What am I looking for? What am I going to experience? And a lot of the times the doctors will not talk to you about these issues because they don't want to scare you.
Oh.
And so, and that's what I was told. Oh, well, we don't tell you because we don't want to scare you. I'm like, you're scaring me by not telling me.
Yeah, and you
because
I
can make a better exactly.
So tell me.
I don't want to learn after the car hits me. I want to learn how to jump before the car hits me. So it's that mentality that I use.
Right.
So tell me everything I need to know before time. So and sometimes too, when you have breast surgery, they might do a secondary surgery where they'll take skin from your back or from another area of your body in order to fill the skin from the mastectomy or whatever, And so being able to say, well, how's that going to affect me?
Right.
And am I going to feel comfortable or uncomfortable by the fact that now I have surgery in 2 different places and I have scars in different places? If you're a nudist, here's an issue. If you're not a nudist, but you feel, do you have sex with the lights on or the lights off?
Right.
I always think you should have the lights on so you can see the package that you're getting. And you can also see if there's any STDs.
That's
always
true.
have the lights on.
Oh, that's scary.
It's totally different issue, different topic.
Right.
But it also allows you to then say, this is me.
Right.
And
they
be
have
comfortable
to accept
with you.
if they could. If they can't, then you move on.
If they can't, you move on.
Right.
Or you come
talk
to
about it.
you come to terms with your partner.
Right.
Hey, I may not look like I used to, but this is the new me.
Right.
This is my new normal. This is
Right.
this
And
is
if you
what
can
I'm
handle
gonna
it.
look like.
Right.
And this is even before your partner becomes comfortable with it, you have to become comfortable with it.
Right.
So you need to look in that mirror.
That's
you need to
true.
go, this is what I look like now.
Right.
I've got scars everywhere. I'm like Frankenstein's bride's, clone. But it's, sometimes I'll look and I'll go, damn. It just looks horrible. And other times I just go, well, it looks horrible, but I look like I have a starburst. The universe exploded in my breast. But it's the jokes that you make for yourself.
Right,
to
you
keep
have to
yourself going.
joke. That's right. But speaking of, issues and talking to your doctor and your doctor talking to you, I've read about there's been some problems with young people that get cancer that are 18, 19, 20 years old, that the doctors feel that they don't have to talk to you. They're going to talk to your parents. And it's not fair. These 18, 19-year-olds are saying, I want to be told this. I want to be told the side effects of my medication. I want to be told, hey, maybe I should freeze my eggs.
Yeah.
Why are you telling my parents? It's my body. So they're trying to get together and band together and speak up about it.
And that goes back to the very importance of being able to be a part of your own treatment.
Right.
Not only for you to know what's going on, but also for the recovery aspect of it.
Right.
Because studies have shown that if you're a part of your treatment, then your actual recovery is better.
Right, because you feel like you have some control over it, right?
Yes,
too.
mentally
Yeah.
it's better, and physically it's better because now you're actually doing what you need to do.
Right.
With whether you're going for traditional therapy and treatment or different, holistic therapies and treatments. It's, I'm a big believer on it being your choice.
Definitely.
Regardless of what the treatment options are, it's your choice whether you have radiation, chemo, whether you're on the pill, the
Right.
cancer pill,
Oh, yeah, that fun pill.
anastrozole, or any other
Right.
pill that they give you for cancer. It's your choice to be on that. And if you decide not to, do not be shamed or
Right, or pushed into it,
because
That's
it's
true.
your quality of life and you decide that.
Yeah.
And so talking to your doctor about it, seeing what the odds are. I'm a big
Right.
believer in, well, if it's only 14% that this medicine is going to help me, but I have 86% chance of never getting cancer, guess which one I'm going with.
Right, that's true.
You know?
And I think a person, who's 18, 19, 20, 21 can make some good decisions as long as they know everything. So what they call it is AYA, is adolescent and young adults who are getting cancers, and they want to be able to have a discussion with their doctors about these treatments.
And it might be that you turn around and you go back to your mom or
Of
your dad
course.
and say, I don't know what to do, but thank you for informing me.
Right. Because otherwise,
help me
how
make
do
this
you feel
decision.
about
Because
yourself?
even as an adult, you're like, I
Yeah,
don't
we
know
don't
what
know what the
decision to
hell-
make.
Yeah.
Let me find out. And if you're not an advocate for yourself and you're not going in and doing, learning, getting your PhD in cancer,
Oh, yeah.
then you don't know all the options. You don't know that all
Right.
of these other situations are going to come up. And so
that's
again, Breast Cancer from Diagnosis to Surgery is an awesome book that talks about not treatment options, but things to consider
Right.
that you will that will come in and affect you. And then by all means, talk about treatment with your doctor,
Right, and then
with your
make a
loved
decision.
one, with everybody else. Some of the things, we always run out of time because we have so much information
Right.
that we're sharing and we just don't have the time. We will have these websites and information on our website, cancertamer.org. So feel free to get information. Don't forget the casting call on April 6th. And
60 Clinton Avenue, 11 to 2.
11 to 2 at the Unitarian Church on Staten Island. If you want to come and do the Faces of Breast Cancer and the 60 seconds messages of hope. And by the way, if you're not in New York, you can always email us the information. Thank you for watching. I'm Dr. Charley Ferrer.
I'm Deborah Santulli-Barone. Thank you.